I wasn't deemed sick enough. I was telling them this is not normal, and they didn't listen.
Mia says climbing helped to save her life. At just 10 years old, both she and her family knew Mia needed mental health support.
Wow.
But their attempts to access help were met with delays and denials.
By the time I was 12, I was self-harming. I was, I felt like some days I couldn't cope with the day, but I was still performing well academically, and that, when you're a kid in this country, that's how they mark your well-being.
This photo was taken when Mia was 15. Just 2 months before, she was arrested for false imprisonment and criminal damage after an attack on her teacher, and eventually she was admitted to a psychiatric unit.
I would have killed myself. I would have. Mental health care is life-saving. You cannot live a healthy, happy life. You cannot live a life if you are mentally unwell without support.
NHS England estimates a quarter of all 17 to 19-year-olds now have a probable mental health disorder, compared to 1 in 10 just 6 years ago. Community health services are also struggling. A survey of NHS providers found that children are now waiting an average of 91 weeks for an autism spectrum disorder assessment and 207 weeks for an ADHD assessment.
You come in as well.
Jenna Hughes had to wait 3 years for a diagnosis for her eldest child, Amelia. Her youngest, Imogen, has already been waiting for a year.
I've struggled with my mental health because of the level of care my children need. The NHS is overrun, but it puts so much pressure on families and strain and stress.
Demand is only expected to increase. If there's no urgent action, healthcare providers like the Hertfordshire Community NHS Trust predict that by next year, their community waiting lists for children and young people will have more than doubled since the pandemic.
It's absolutely not where we want to be. We want to have much shorter waiting times for children. It significantly affects their life chances and their educational attainment if we don't see them quickly. The biggest challenge in terms of community services is not the vision for what we want to do, which is clearly to support people at home and to help children develop as best as they can. It's getting the staff and growing the services quickly enough to be able to respond to that.
The impacts of the COVID pandemic are being felt across the NHS. On the services we rely on to treat our youngest and most vulnerable, and on the parents who try so desperately hard to care for them and are struggling to cope. Ashish Joshi, Sky News in Hertfordshire.